today for our webinar session on privacy and security risk analysis. My name is Liz Frenchkowski, and I work with the Massachusetts eHealth Institute, and I'll be your moderator for today's session. Just a couple of quick housekeeping items before we begin the webinar. I wanted to let all of you know that if you do have questions throughout the webinar, we invite you to type them into the question box on the GoToWebinar guide on the side of your screen, and we'd be happy to run through all of the questions in the order they were received at the end of the webinar. Throughout the webinar, we will have periodic knowledge checks, as we call them, and these are basically frequently asked questions that we have received from the provider community that we would be happy to answer in order to highlight some of the key issues that we want you to remember from this session and take away with you after today's session is complete. So without further ado, I am going to turn it over to my colleague Thomas Bennett to begin the presentation. Thomas?
Thank you, Liz. Hi, my name is Thomas Bennett. I'm a Client Services Relationship Manager with the Mass eHealth Institute. And I'm just going to kick us off and talk a little bit about how what we do matters and a little bit about what we do specifically here at MeHi. Looking at this slide here, you can see in terms of the vision how this state, Mass, is the global eHealth leader. Our connected communities throughout this state are already at a stage of enjoying better health and lower cost, and is seen across the country as a model of innovation and economic development. The mission here, of course, is to engage the healthcare community. That is our charge to touch and support healthcare providers and practices across the state in terms of their development and being the state's entity for healthcare, help accelerate the adoption of eHealth technologies. You can see the goals here. The adoption rate of 100%, of course, is the goal of interoperable EHRs across the state, and we're doing that. Born out of the Healthcare Reform Acts, achieving the triple aim of better health, better care, and lower cost. The goal, consumer health engagement, helping practices to better engage and interact with their patients, involving their patients, and as well on our end as well in terms of engaging the healthcare community. And then lastly, grow and promote innovation and the eHealth cluster. You can see there are some goals there for 2020 around the number of companies and the amount of money going into these goals. Next, again, is here at MeHi, being the state's entity for healthcare innovation and technology. What we do, of course, we're tasked with supporting healthcare providers in achieving meaningful use of EHR technology, and we do that in a number of ways. A few examples here, one of which being meaningful use gap analysis, help supporting providers in achieving meaningful use. A lot of this is done through the different EHR incentive payment programs. We perform assessments in terms of where you are in reaching or achieving the different measures and requirements required of these different programs. We support providers as well with registration and attestation support. This is getting involved and enrolled in these different EHR programs that are available, and then providing assistance around the application process, and then final attestation once you've achieved the different stages of meaningful use. Secure document storage and audit preparation is another area where we're supporting providers. Supporting documentation is an important piece in terms of having backup around the different pieces of the programs that you might participate in, particularly with meaningful use, and we provide secure document storage for that and audit preparation. And you'll learn more as we go on with this webinar, where privacy security is an area where the secure document storage and audit preparation is critical. We also support providers with the Physician Quality Reporting System, better known as PQRS. MeHi, we provide a CMS qualified registry for submitting your PQRS measures. Those of you that are participating in that know that the deadline is very near this week. We also collaborate with external partners, one of which being Blueprint, we're working with today around privacy and security tools, and we'll get more in depth on that in just a moment. We also collaborate with partners around patient engagement resources and other health IT resources. And you'll see those within our resources here at MIHI, particularly within our MIHI member portal, where a number of these tools and resources are housed. We also engage in thought leadership, this being an example of these webinars that we put on to help educate the provider community. Training courses are also included with that, and subject matter expertise on topics of interest to provider organizations across the state. We work with providers across the entire state, different specialties and types of practices, and we're able to obtain a great deal of insight that we're able to pass on to providers when we provide services. Next is the disclaimer. I need to let you guys know as we move on that MIHI does not take any responsibility for the actions of physicians and their staff. MIHI acts as your trusted advisor for meaningful use in health IT, and while MIHI will provide direction and connect you to appropriate privacy and security organizations and other services, physicians and their staff are solely responsible to take the steps necessary to protect the privacy and security of protected health information. Okay, and with that, I will pass it to Mark at Blueprint.
Good afternoon, everyone. My name is Mark Ferrari. If we can advance to the next slide. Okay. I'm the Director of Operations for Blueprint Healthcare IT. Just to give you some background, Blueprint has been around since 2003, and we have three main practice areas. One is focused on security, privacy, and compliance specific to the healthcare industry, and our other two areas of focus are care optimization and regional care coordination. We work with multiple regional extension centers in all of these capacities. With respect to security, privacy, and compliance, as I mentioned, we focus specifically on healthcare, and we are a certified high trust assessor. On that subject, I'd like to introduce our principal consultant in our security, privacy, and compliance practice. His name is Ryan Patrick, and he'll be going through a lot of the topics today regarding compliance. Ryan joins us with a very robust background of over 15 years in information security. His healthcare focus comes from experiences with MetLife and with Memorial Sloan Kettering Cancer Center in New York City. He served as the Deputy CIO for the New York National Guard and retains a commission as a major in the New York National Guard, currently serving as the Chief Information Officer for one of the National Guard regiments. So I put you in good hands in turning the presentation over to him, and take it away, Ryan.
Why, thank you, Mark. Good afternoon, everyone. As Mark stated, Ryan Patrick, I'm going to serve as your captain as we navigate through today's learning about the security risk analysis and some of the state and federal laws that accompany that. So what you're looking at now is today's agenda. We're going to go over, like I said, the current landscape of healthcare with regards to patient information and protecting that information and providing care just generally. We'll look at meaningful use, the security risk analysis, and then we'll sum it up with some myths about the security rule, meaningful use, and a demo of Security Connect. So here's our philosophy. We want to make the process simple. We know that you all are busy providing the best patient care that you possibly can, so the goal is to make this as simple as possible, as succinct as possible, and help everybody get to where they need to be. Today's learning objectives, you'll have a better understanding of state and federal laws. You'll learn how to implement the HIPAA security rule and meaningful use in your organization, and then you will also have a better understanding of how to use Blueprint's Security Connect tool to become compliant with the security rule and meaningful use. So here we are, the healthcare landscape. A lot has changed recently, the biggest one being the transition to electronic medical records. this really changed the game because now it's a lot easier to move patient information from provider to provider. With that ease becomes the susceptibility and the vulnerability of disclosing that information to undisclosed or unauthorized recipients. So this was a kind of a game changer in the healthcare field in both a positive and a concerning way. Some other factors, influencers, things that have shaped the environment is meaningful use, HIPAA, high-tech, and then other state and federal laws. All right, so one that's near and dear to all of your hearts is the Massachusetts Code for Regulation. This was established to set minimum standards for safeguarding personal information contained in both paper and electronic formats. This is not healthcare specific, so that's important to keep in the back of your mind because you have dual reporting now within the healthcare arena and then just general personal information arena. And I'll get into that reporting a little bit later in the presentation. But of note, what this regulation kind of encompasses or focuses on is the first initial and last name plus any one of those other identifying factors. So if there is an unauthorized disclosure of that combination of information, then it meets the requirement, and there would have to be a notification. So a part of that, the regulation requires that these persons or entities develop and maintain a comprehensive information security program. So what does that mean? Well, at first you need to designate one or more employees to maintain the program. Now, it's important to keep in mind that this employee or employees do not need to be security experts. They just need to be the keepers of the program, someone to stay focused on it. And what the program consists of is identifying and assessing reasonable, foreseeable internal and external risks to the confidentiality, integrity, or availability of these records. So this next slide that we're looking at, it includes more guidance from the regulation on what the program must include. I'm not going to go line by line, but it's important to note that these reviews of the security measures and the risks should be done at least annually or whenever there's a material change in business practices. So when it comes to the Comprehensive Information Security Program, it focuses specifically on the computing systems and the computing environment within each organization. And it wants each organization to, at a minimum, focus on these areas to the extent technically feasible. Talking about user authentication, making sure that there's username and passwords on these applications, access control, making sure that just because you have a username and a password doesn't mean you get to see everything in each one of these applications. There's system monitoring, make sure there's encryption, so any data that's being transferred is protected in transit. And bottom line is education. And just the fact that you're all on this webinar today is a testament to your focus on education, because that is one of the more powerful tools you have in protecting not only your patient's information, but your organization as a whole. Okay, as I stated previously, the regulation requires notification. That notification must go to the State Attorney General and the Office of Consumer Affairs and Business Regulation. We've added the website on this slide for your review. Part of that notification, it requires some specific information, and you'll see the list there. It talks about a detailed description of the nature and circumstances, the number of Massachusetts residents, steps that's already been taken, steps to be taken, and then any information regarding law enforcement notification or involvement in the investigation itself. Now, there's one thing I want to touch on before we move on to the next slide. Is you're going to see as we go through these slides that they're somewhat wordy, and there's a lot of information, and that was by design. The goal of these slides are that you can take these back to your staffs and provide some training based on these slides. So you're going to see there's more information than you normally would see in a presentation such as this.
Thanks, Ryan. We'll pause here and do a quick knowledge check. What types of information are considered personal information according to Massachusetts 201 CMR 17.0? And the answer for that is the first initial and last name plus the Social Security number, any state-issued ID such as a driver's license or photo ID number, and an account number even without the PIN. So as Ryan was stressing earlier in the presentation, these are the data elements that are considered personal information, and if there is release or accidental disclosure of these elements, that have to be reported. Ryan?
Thank you, Liz. All right, so now we're going to get focused on some of the federal laws and regulations that are pertinent to you all. Those consist of HIPAA, then the revision of HIPAA with high-tech, omnibus, and all the associated rules and regulations. It's important to note that systems and controls should comply with the most stringent of requirements, whether it's at the state or federal level. So if the state requires more stringent controls, then that's what you should be aiming for. So here we are, HIPAA and high-tech. All right, so high-tech, it revised the original HIPAA law and kind of enforced tougher provisions for security, privacy, and enforcement. There were some increases in the penalties themselves, which we have a slide that speaks to that. The reporting requirements changed, and you can see some of the venues for that. And of note, the high-tech gave state attorney generals the authority to bring legal action against physicians and hospitals for non-compliance. So that's something to keep in the back of their mind. It's not just the federal government that is looking, but also the state attorney generals now have that authority. So as I mentioned, we have a slide that speaks to the violations and penalties. You'll see that the violations get worse as it's identified that the provider or covered entity willfully neglected to address any of the security concerns or attempting to protect patient data. So high-tech specifically, new provisions. This one was a win just generally for covered entities. It extended that coverage to business associates of providers. Now, those business associates are considered covered entities and have to maintain the same level of security and due diligence to protect that information as covered entities themselves. Also, of note, it increased the patient's right to restrict disclosure of PHI. Omnibus itself, it further expanded the business associate definition, and it strengthened the harm provision, which is the assumption of harm unless proven otherwise. And then also it included the Genetic Information Non-Discrimination Act underneath the HIPAA privacy rule. So you may be wondering, why are we telling you all this? What does it mean? Why are we here? And I'm going to get into some stats from a recent study. The global cost per record in 2013 was $145 on average. So for every record disclosed, it cost that organization about $145. That's across the board for all industries. So you'll see that in the next slide here, we pointed out specifically healthcare, and that's a dramatic increase to the cost per record. And that's because healthcare is one of the more regulated industries, as you all know. It's all near and dear to our hearts. So this is why we're here, is to look at ways to prevent that cost from being something that we all have to deal with. Now, here's some additional information on what it costs for different types of attacks, whether it's human error or some kind of system flaw or glitch, or as notable in most news stories, some kind of a malicious or criminal attack. So what can you do? Part of what you're doing right now is you build a strong security posture, understanding your environment, understanding where your vulnerabilities exist, and looking actively for ways to strengthen that posture. It saves you money in the long run. So the next slide speaks to the Health and Human Services breach notification site. I've got a screenshot there just to kind of show you what the site looks like, look and feel. But see at the bottom that there have been 1,142 reported breaches of 500 or more records since October 21st, 2009. That's pretty alarming. That does not include any breaches or disclosures of records under 500. So you can imagine that that number would go up alarmingly. A story of note, Presbyterian Hospital and Columbia University combined two different disclosures or incidents, if you will. Total cost in HIPAA settlements was $4.8 million. That's pretty significant and very eye-opening. I wanted to highlight this report because it shows that the simple little things could affect you and could result in a disclosure or unauthorized breach. And this story has to do with vulnerabilities in unpatched or unsupported software. So just making sure that your systems are patched and making sure your vendor for your EHR is doing their due diligence to strengthen their security posture and patch your systems is something that you want to focus on. So here's the goal of HIPAA security. And we're going to get into that, but it's important to realize that privacy and security is the responsibility of physicians and their staff in protecting their patient data. So a part of that is the HIPAA security risk analysis. There are several categories, general categories, which are outlined here on this slide. I'm not going to go into each one of the subcategories, but just to give you an idea of what your security risk analysis should be focused on. And here's the additional categories, and this is more focused on the organizational level, making sure that there are policies and procedures, published policies and procedures that are accepted and approved by senior management, and that there is a focus on contractual agreements between business associates to strengthen the overall security posture. So the HIPAA security rule requires that you establish and maintain a security management process. Now, the first step of that is risk analysis, and that's just to conduct an accurate and thorough assessment of potential risk and vulnerability within your environment. The second piece is risk management. All of that's really speaking to is anything that you identify as a risk or a vulnerability, you're doing your due diligence to reduce that risk in whatever way, shape, or form, whether that's mitigation, transferring risk. It could even be risk assessment as acceptance, as long as senior management is involved and gets on board with that. So here's some additional guidance put out by Health and Human Services. You need to define the scope of your actual risk analysis. Then you're going to go into a data collection phase. You're going to identify and document threats and vulnerabilities, assess current security measures, determine the likelihood, determine impact. Between the likelihood and impact, you're going to determine the level of risk, and then you're going to work some of the documentation pieces. But most importantly, take note that this is a continuous process. It's not something you do once. You need to continuously look at your business processes in your environments to make sure that there hasn't been a new vulnerability introduced. So make sure you're doing periodic reviews and updates to the risk analysis. It's not the full-fledged assessment, but it's a review. And that's what this slide really speaks to. The important takeaways are know how and where your organization is at risk and determine the appropriate strategy, and then continuously try to manage that risk as, like I said, business practices change or your environment changes, you have a new piece of software, what have you. So what's the relationship between the security rule and meaningful use? Well, you use the HIPAA security rule when you're doing your attestation for meaningful use. So they're very much interrelated, and having that understanding of both is what's going to strengthen that security posture overall for you. So stage one, as I'm sure you're all familiar with, was focused on providers capturing patient data and sharing that data. Stage two was more focused and looking at health information exchanges to promote patient engagement, which you're probably seeing a lot more of now, is that focus on patient engagement, trying to get everybody on the same page when providing this care. Now, stage three has yet to be really flushed out and determined. It's scheduled to be released next year, so much like you, we're anxiously and eagerly awaiting to see what the details of that is, or are for that matter. All right, so we're going to jump into some myths of the security rule and meaningful use. I'm not going to go through every single one of these and read it word for word. I don't want to bore you with that, but I just want to highlight some of them as we move through these slides. The security risk analysis is optional for small providers. This is false. All covered entities are required under HIPAA to perform that risk analysis. The second one, installing a certified EHR fulfills the security risk analysis for meaningful use. That is also false. It still requires that the organization itself, the covered entity, does a full security risk analysis. And then the vendor of that EHR is the only one that needs to be focused on privacy and security. That is also false. As I mentioned in the previous slide, it is up to the covered entities and their staffs to be focused on privacy and security. The top one is important from a financial perspective. You have to outsource security risk analysis. This is not true. The security risk analysis can be done in small organizations that may not have the funding to bring in someone who may have the subject matter expertise and experience. It is designed, and we'll get into the Security Connect tool, which is specifically designed for this purpose. So another myth is the security risk analysis only needs to look at my EHR. This is false. The security risk analysis looks at the business and the business processes as a whole, which would include your EHR. So you're looking at the entire organization and where there may be vulnerabilities. And I'll give you an example. If you don't have published policies, excuse me, and user training or staff training to understand privacy and security, then you could have a staff member who doesn't understand that they need to be protecting patient information, and they could disclose that information, say, to somebody who calls up, whether intentional or unintentional. So it's important to realize that the security risk analysis is very much comprehensive and all-encompassing when it comes to your organization. So the one I want to highlight on this slide is the second one, that you have to completely redo the security risk analysis each year. That is false. As I previously mentioned, it is a continuous process, but each year you're going to be focused more on just reviewing it to make sure nothing has changed. If there has been a change, whether new software or new business practice, that is updated in your security risk analysis.
Okay, thanks, Brian. So we'll pause here for a couple of quick knowledge check slides, just to reiterate some of the key elements of Ryan's presentation so far. The first question is, how often should I complete my security risk analysis? As Ryan mentioned, full security risk analysis should be performed when you adopt your EHR, and thereafter you should always update the prior analysis for any changes in your risk. So whenever changes to your practice or electronic systems occur, to reiterate, to comply with HIPAA, you must continue to review, correct, and modify and update your security protections. And under meaningful use, EPs have to conduct a security risk analysis prior to or during their EHR reporting period, and a new review must be completed for each subsequent EHR reporting period. So again, this doesn't need to be a full analysis each year, but it needs to be reviewed each year. A security update is required if any security deficiencies were identified during the risk analysis or review. The next question is, my EHR vendor conducted a security risk review. Is this sufficient to meet the meaningful use core measure? And the answer is, your EHR vendor may be able to provide assistance and training on the privacy and security aspects of the EHR. However, for meaningful use, it's your responsibility to complete a thorough security risk analysis and to implement a plan to mitigate any security risks. And as one of the myths and facts highlighted, all of the risks don't necessarily need to be mitigated prior to testing for meaningful use, but you need to have a plan in place about how you do plan to mitigate those risks. So you need to have a written plan and then carry that plan out. Be sure to review not only your EHR hardware and software, but all electronic devices that store, capture, or modify PHI. And in addition, while your mitigation plan could include updates to your EHR software, it should also include changes in workflow processes or storage methods, and any other corrective actions that are necessary to eliminate the security deficiencies identified in your risk analysis. Finally, my organization has multiple locations. Do we need to conduct a separate security risk analysis for each location? And the answer is, a thorough security risk analysis should take into account all the electronic devices that store, capture, or modify PHI. Because that might vary by location, a generic organization-wide SRA may be insufficient. So your security risk analysis should take into account all the variables that may impact the security of PHI for each specific location. At this point, we're going to go through a demo of the Security Connect tool offered by Blueprint. So I'm going to turn over the presentation to Mohit from Blueprint, and he will walk us through a demo of the Security Connect tool.
Our idea with the tool was to make the process easier. So whoever is handling the process at the organization, whether it's the office manager or it's the physician, whoever is handling the process, we wanted to make it easy enough for them to go through it and then be able to identify issues and also work on it. So not just giving you a report in the end that here you go, these are the issues that you have. It actually completes the loop in the sense that it guides you through what needs to be done. So I'll just go ahead and log into the portal at this time. So this is the portal that you will get to see once you've provided access. I'm logging in as a physician. The office manager gets a similar view when they log in. So that's indicated by the name on the top. The PHY for our demo indicates the physician. Right in the beginning, it gives a quick introduction with screenshots of what needs to be done and how to use the tool. So that's something that you'll see when you log in up front. And then essentially for the assessment itself, you will click in the left navigation bar, go to the security risk assessment. You'll be presented with a list of assessments that have been assigned to you or you're working on. So I'll click on edit responses first. So I'm trying to give you a view of what the experience might be from a physician or an office manager's perspective. So this is the remediation. This is the assessment that is brought up in the tool when you click on the assessment link. It essentially consists of certain question categories. So I'll just minimize this for a second so you can see the different categories that are there. And within each category, there is one or multiple questions that you have to go through. It might seem like a long list, But in our experience with other customers who are using this, the average time of completing an assessment is anywhere from 40 to 50 minutes, which is pretty significant reduction in, if you have somebody coming into the practice, doing a physical assessment, talking with your staff. The questions in the assessment have been created so as they are easy to understand and they're easy to respond to. So let's look at what columns we have in the assessment. So you have the question. So we can take this as an example. Is there a designated information security officer for the organization? Then you have response options. So you can do yes, no, or NA, depending on whatever the response is relevant for you. Then we have this icon, which if you hover over it, you would get to see the standard or the regulation behind asking that question. So, sometimes when you look at an assessment and the question in there, you might ask, why am I being asked that question? Well, there is a reason for that, and the reason is, the standard or regulation. So that's from a knowledge perspective, you can see that. The next column indicates the status, which is pertinent to that particular question. And when we go to the prepare remediation plan section, you'll see the different statuses, but some of them are visible here as well. You have risk mitigated, risk accepted, remediation completed, and there's another one that I want to show you, which is, if I can find it, maybe not. Here it is, pending. So those are the various statuses through which a question can go, and that also impacts the remediation plan that is created. So just scrolling up for a second. And then the last column here is ask a question. So essentially, this gives you an opportunity, as the physician or the office manager, despite the fact that you have the guidance here from the standard regulation perspective, even if then you have a question and you want to direct it to somebody at MIHI, you can use this functionality. It essentially is a simple form. You enter your question and you submit it. It gets routed to somebody at MIHI who can then respond to that. And then the remediation recommendation is dependent on your response to a particular question. So in this case, the response was, no, we don't have a designated information security officer. In that case, the tool is automatically recommending, well, you need to appoint a qualified workforce member who can be responsible for that. So that's, that was the idea behind the tool, that don't just give you, not just give you a report on where the gaps are, but also guide you in terms of what the remediation is and what you need to do about that issue. And as far as the plan submission goes, the assessment submission goes, there's a submit button down at the bottom. Once you're done answering the questions, you submit the remediation, keep calling it the remediation plan. You submit the assessment, and that gets routed to somebody at MIHI for a review. In addition, what you get to see is this download remediation plan link. So if I click on this link, it is going to generate a PDF document. Zoom it up a little, which is going to indicate your response for a particular question. What is the risk rating associated with that question? What is the current status? And if a remediation recommendation is in order, it lists that as well over here. So within, as soon as you complete or submit your assessment, you can download this remediation plan. You don't have to wait for somebody to actually review it. The tool automatically provides you with that information. So what do you do with that information? So the next step is going to be prepare a remediation plan. So this is where you are now working through the remediation plan, and you are either recording the activities that you're doing. So first of all, you make your plan, and you'll be recording the activities that you're performing. and subsequently, you will be updating the status of that particular question. So how do you do that? So you have your question, you have your response, you have your remediation, recommended remediation over here. You essentially click on Add Edit Remediation Details, which brings up this form. So think of this as a tasking tool for who this remediation needs to be assigned to, what is the begin and target date, and once it's completed, what is the completion date. And you can print a report out of this, which I'll show you a little later on. But you're basically tasking people in the organization to act on a particular remediation that was recommended. And as you work through that remediation, you can also enter progress notes. So this shows you an example of a few progress notes that were added. You essentially click on this link, Add New Progress Note. You can assign it to somebody, add the progress note. And this goes a long way, in case there is an audit and you're asked for, okay, what are you doing about this particular issue that was identified for you? Well, here is the list, and you can even print this into a PDF format, and it gives you a complete log of any activity that you might have performed for a particular remediation. The other section, so that's as far as the assessment and how to generate the remediation plan and also track your progress notes as far as that is concerned. There's some other sections in the tool which are very useful, especially the resources section. So this essentially contains a list of resources that can help you through the process. So FAQs are essentially for you to understand the process, how it works, what are the steps involved, how do you use the tool. There's some useful acronyms, which can sometimes be confusing. So here's a list of acronyms that you can look at. HIPAA security rules documents that you can review, other useful documents that you might want to download or visit. There is a marketplace. In this marketplace, essentially what we've done is we have listed the industry leaders for particular products that you might require as part of a remediation. So for example, antivirus, DLP tools, vulnerability scanners, and then there is a link to actually go to that company's website and purchase that product from there. Then we have regulations. We have websites, again, just to make that process easy for you. Then we have the remediation progress scorecard. Essentially, if you remember, we were putting in what actions are we performing to reach a particular, to actually comply with the remediation that was recommended. This gives you a list. It gives you, what the question was, what was the response, the remediation, who it's assigned to, what is the begin and end date, whether it's completed or not. And then you can print progress notes for that individual question. Or you can download the entire remediation progress scorecard if you want to use it as a project management tool, for example, to track. So you can do that, and it lets you download that to Excel. So with that, Liz, that completes the demo portion of the tool. I'll hand it back to you.
Thanks very much, Mohit. I appreciate it.
Thank you.
As we were talking about in the presentation, the important thing for meaningful use is really identifying the risks that may apply to your organization, and then secondly, having a plan in place to address or mitigate those risks. So I think the remediation plan offered in the Security Connect tool is really an awesome resource because it allows people to keep track of who's been assigned to a particular task and then keep progress notes on how that task is coming along and completion dates and all of that. So it really addresses both parts of the security risk analysis, not only identifying the risks, but then developing a plan, an action plan to address or mitigate those risks. So we appreciate the demo. Thanks, Mohit. At this point, I'll turn it back over to Thomas Bennett, who will talk a little bit more about the knee-high services we offer and how we can help you with your security risk analysis. Thomas?
Thanks, Liz. So let's take a look at MIHI membership. And this is specifically as it pertains to meaningful use support. So the grid here sort of displays our remote meaningful use support on the left here for the type of service. And then that is broken out by the size of practice. So you can see on the first line here, practices with providers 1 to 10. The subsidized price for the service per provider is $6.99. And you can see as it goes down the list here for practices with 11 to 49 providers. There's a discount applied there for subsidized cost of services. And then for larger or large practices, 50-plus providers, you can see the subsidized price there, $5.59 per provider. There's also what we have as what we call premium services. Premium services is given on a per practice basis. So for practice, despite the size or number of providers, is a $500 fee for those premium services. And what's premium is that you would have access to a dedicated relationship manager at any time, and then also on-site assistance with meaningful use. Below that, we're looking at our privacy and security workshop, which will be coming up. And you can see the fee for that for members of MIHI currently. That is free, where you can come in and learn more about the privacy, security, and as well as the security risk analysis, and get an opportunity to actually get started on yours. And that for non-members is $4.99 per provider. And again, that workshop will give you access to the Security Connect tool. And again, just further with the upcoming workshop, as you know, it's been stated and restated throughout this webinar. We can't mention it enough that the security risk analysis or inadequate risk analysis is the #1 reason why providers fail meaningful use audits. So again, we have a workshop that we're providing on Wednesday, April 22nd. This is a chance to get on track with your security risk analysis, where you can assess your practice's privacy and security status, begin developing your remediation plans to help resolve any gaps that you might have based on the assessment you complete, and communicate resolution steps to providers involved, and track your progress in addressing some of the outstanding issues. So again, this is on Wednesday, April 22nd. We will be sending out a link to those to be able to register, and that will include final details in terms of the place and time for the workshop on the 22nd. And again, it is free to all MIHI members.
Great, thank you, Thomas. So as Thomas mentioned, the workshop is April 22nd. We don't have a specific time frame yet, but this is more of a save the date notification so that you can keep that date in mind. And then once we do have a date and, a time and location set, we will send out a registration link. And if you're interested in learning more about the workshop or anything else, you can always contact us.